Thank you very much to AIOS and the judges for bearing with me. Can I have my paper, please? Do we have a pointer? Pointer? No pointer? Okay. Can you start? No, this is not it. This is Kirti Khoka. Kirti Singh, abhi diya na gaps. Free paper, I think it's 6-3. I just gave it to you. So it's a pleasure to present.
इसके पहले वाला फोल्डर
ये आपने अगला वाला शुरू कर दिया शायद.
उसके ऊपर वाला
This presentation from Guru Nanak Eye Center. Thank you for AIOS for this opportunity. Patient profile and referral practices for glaucoma. What are the goals which are still unmet? How do I forward it? You'll have to start the timer again. Beta forward nahi ho raha isme. Okay. How come there is? If you could just start the timer again, please.
मैम मिला 30 seconds you can continue.
Okay, no problems. So any goal will have good strategies can still fall through the cracks if we don't do a gap analysis. And for this gap analysis in any healthcare system, we need to have studied two players. The two players are the doctor and the patient. And that's exactly what we did with the aim of evaluation of clinical characteristics of cases referred to glaucoma in Guru Nanak Eye Center, New Delhi, a tertiary care medical college, to study both the knowledge and health-seeking behaviors of patients with glaucoma, and most important but not the last but not the least important would be the referral practices of glaucoma cases with special emphasis on missed angle closure glaucoma. It is a hospital-based observational cross-sectional study, and all the patients coming to the glaucoma clinic, all the primary glaucoma cases were taken. The outcomes were the subtypes and type stages of glaucoma, and the second primary outcome was missed ACG diagnosis or documentation by the first care doctor. Secondary outcome was the patient awareness and knowledge of glaucoma by a self-designed validated questionnaire adapted from Prabhu et al. Duration of symptoms and reasons for delay in presentation. Why were these outcomes taken? Because this is what I found over last so many years of doing glaucoma practice, that's a problem. So 500 adult patients with primary glaucoma, 60% males, 86% were 7th decade or older, of mixed ethnicity, both Hindus and Muslims. Majority at 43% lacked any formal education. They were coming to the government sector. 74% had no source of income. They were dependent on their children. That's important because in glaucoma, you don't treat just the eye, you treat the patient. There was no health insurance for any at that stage. 85 patients were residents of Delhi. Despite that, Delhi is a wide sprawling city. 73% traveled 10 to 30 kilometers for drug refills. The delay in treatment, seeking treatment of more than 6 months, was seen in 41%, and 1 to 6 months was in 48%, which was huge. And this delay was due to ignorance in 62%, no access to nearby health facilities, and mind you, this sitting in Delhi, the capital of India, 36%, and lack of caregiver, the important thing, 22%. This picture shows you exactly what the problem with the caregiver is. Most of these patients are old, and this son-in-law brought the mother-in-law ki the son doesn't take care, so I'm going to bring her, and she had come with end-stage glaucoma. The glaucoma subtypes, as expected, POAG was equivalent to PACG, as has been published from our hospital previously. 48% had severe visual defect, legal blindness in 37%. Of all the blind patients, PACG compromised 46%, almost half. 1/4 cases required laser or surgery prior treatment. Now, this is the important thing. 28% had already undergone a prior filtering or a cataract surgery. 62% were on anti-glaucoma medications. On the ACG subtype, only 20% had a prior peripheral iridotomy. 80% were undiagnosed. And most of these PIs were done in our hospital. Referral practices, prior diagnosis of glaucoma was seen only in 20%, despite many of them being on anti-glaucoma medications. despite a qualified ophthalmologist being the referring physician in 92%, and 28%, as I said before, had a prior ocular surgery, invariably cataract. The criteria for referral to our clinic was high IOP in 60%, dissuspect 39%, poor vision, visual field suspect, gonio suspect was abysmally low at only 5.4%. Gonioscopy had been neither performed nor documented in 80% by the primary care ophthalmologist. And that's a really, really sad situation in India. This is the referral practices. As I said, 92% had been seen by a qualified ophthalmologist. None of them had done a gonioscopy, and they had missed angle closure glaucoma, which in time could have been prevented. Patient awareness was poor at 9.2%, knowledge even less. 95% were ignorant about the cause. Only 8% understood irreversible nature. 5% felt IOL would reverse it. 20% were unaware that after surgery also they would need follow-up. This is our the questionnaire which we designed, and this has been echoed. We are echoing the many studies of Venkatraman et al. From Coimbatore and the Chennai study, which says gonioscopy was not performed. Determinants of awareness were occupational, educational status, and disease knowledge, and surprisingly negatively associated with older age and male gender. Poor adherence also was analyzed. Irreversible disease and no perceived benefit, difficulty in using medication, asymptomatic disease in early stages, and hand-eye coordination problem and forgetfulness were the main common cause. So goals still unmet are patients presenting with advanced disease in 48%, delay in treatment results from ignorance, poor access to health facilities, lack of caregiver, despite ACG comprising 50% of hospital glaucoma population. Referral practices or lack on performance of essential gonioscopy was pretty bad, 80%. Awareness was poor at 9%. Education and lack of disease were identified as a key things. So our learning was education is required, perspective, surgical option, exercise early. Many patients depend on free medications, do rational therapy. And again, in the gap analysis, we started doing a gonioscopy and perimetry workshop in our hospital, successfully 2 done over the last two years, and our counseling practices. Thanks to my glaucoma team.